Good afternoon, everyone. I'm Barbara Ferrer. I'm the director of the Department of Public Health for the County of LA. And as always, I'm here to make sure I provide you with an update on the number of cases here in LA County and also try to address some of the ongoing concerns. I do want to start today with a note that we're reporting 40 new cases, which means the total case number is 230 for the County of LA, and that includes the 10 cases reported in Long Beach by the City of Long Beach Public Health Department, and the 2 cases that are reported by the Pasadena Health Department. Unfortunately, today I'm very sad to report that we have had an additional death here in LA County, which brings the total count to 2 deaths here in the county. And I want to express my deepest condolences to the families and friends of the person who's deceased. I'm so sorry for your loss, and I hope that you know that we as a community are mourning with you. The person lived in a small community in an area around near Pasadena. The person was a relatively young person between the ages of 30 and 50. And the person had an underlying health condition. All the confirmed cases that we have are being isolated and close contacts are quarantined. And as always, we will post by the end of the day today a report of the LA County case counts on our website, www.publichealth.lacounty.gov. As a reminder, we're going to continue to see an increase in positive cases over the next 4 to 12 weeks, but that doesn't mean that the important actions that you're all taking to combat this virus are not working. Social distancing is critical, and we implore you to take seriously everyone's obligation to limit their exposures to others and to limit others from being exposed to you. This is the one way that we all can be serious about what it means to try to slow down the increasing numbers of cases here in the county. Because COVID-19 is widespread, as a general rule of thumb, you should assume that you may be infected and that others around you may be infected, and therefore act accordingly. Take every precaution possible to avoid infecting others and to avoid becoming infected. That's the goal of social distancing. If we all adopt this mindset and we act accordingly, it will slow the spread of COVID-19, and it will keep you and your family and those most vulnerable in our communities safer. Everyone should remain at home as much as possible. Feel free to take that walk, hike, or run, just not with a group of people. Those who can work at home should work with their employers and make those arrangements. And we recommend that as much as possible, children should be cared for in their homes. So make arrangements with your employers and try to get a trusted babysitter when needed. We always ask that you continue to adopt our best public health hygiene practices, and I particularly want to emphasize that when you do go out, it's important for you to wash your hands before you leave, and it's important for you to wash your hands as soon as you get back. If you don't have hand washing facilities nearby, this is a good time to use sanitizer. I want to give a testing update and appreciate that folks are anxious to get the numbers. And I want to let people know that we have 7 labs that are currently operational and serving LA County, and that these labs have multiple sites where they are testing lab specimens. So our capacity is still increasing every day here in the county, but I want to remind people that it's limited. As of yesterday, we had performed lab tests on over almost 1,700 people. So you can see that every day we are increasing the numbers. And I do want to let folks know that on average, for all of the lab specimens that are tested, about 13% of people who have a test are positive. It's slightly higher for those who are tested through the public health lab and slightly lower for those that are tested on the commercial labs. At the public health lab, about 21% of the people who are tested in our labs end up being positive, and in the commercial labs, it's about 10%. We know that there's a desire amongst many for universal testing, but I want to note, even as capacity increases, you will still need to talk with your provider, and your provider will need to determine that it's clinically appropriate for you to be tested. In general, that means that people with no symptoms of respiratory illness are not going to be tested. If your test was negative today and you were asymptomatic, you had no symptoms, it says nothing about where you would be tomorrow or the next day. So for people who have no symptoms, we ask that you allow the testing capacity we have here to be used for those who are at most risk and need to be tested in order for them to get the clinical treatments that are highly appropriate. Even if you had close contact, and I want to spend a minute on this, even if you're identified as a person who had close contact with a confirmed case and you have no symptoms, you don't need to be tested. If you're the contact of a person who was a close case, you have to quarantine for 14 days. You have to. It's a mandatory order. That means you have to stay out of circulation. You have to not be in any contact with other people for 14 days. If you were to test on day 5 and that test result came back negative, you still have to quarantine for the entire 14 days. The incubation period for COVID-19 is 14 days, and that means that you're going to need to stay quarantined for the entire 14 days. If during your quarantine period you develop symptoms, then you'll be talking with your provider and you would be an appropriate candidate to in fact be tested. But we need to test people who have the symptoms of respiratory illness. I want to also spend just a minute on sort of how we're going to take care of each other during these really very trying times, and how important it is to remember that this pandemic has a human side. And that human side really asks us all to do our best to take care of each other and to take care of ourselves. If you or your family member have mild symptoms, you've heard both me and Dr. Galley acknowledge that you could take care of yourself and other families who have mild symptoms in your home. And I know people have a lot of questions about what does this mean and what should I do in my home if I do have mild symptoms. One thing for sure is you need to rest, hydrate, drink a lot of fluids, and if possible, you can tolerate, if you have a fever, you can take Tylenol if it's safe for you to take. Some of you are on other medications, and you will know that absolutely you should not be taking Tylenol. And if you have questions about your particular situation, that's when you should make that call to your provider. You should isolate yourself as much as possible for others, even others in your household, for 7 days. And what that means in particular is no sharing of utensils and cups. You shouldn't be sharing food. You shouldn't be preparing other people's food. And if you're the caregiver in that house, you take care of children, you should see if you can arrange for another person to help provide care for children, particularly young children. If you do need to care for children because there's nobody else, you need to take precautions. This would be a good time to use a surgical mask if you have a lot of coughing. It's a particularly important time for everybody to be washing their hands, and again, for doing as much distancing as you possibly can. If you have other members in your family that are ill, we ask that you do the same, particularly to try to isolate people from each other so that sick people in the family for 7 days are kept as much as is possible from having close contact with other members in your household. This is particularly important if there are people who are older living in your household or if there are people with underlying health conditions. Not only do we need to take special care if people at higher risk of severe illness get sick, but we need to take a lot of care to make sure if there are sick members in the family, they're kept as far apart from those who are most vulnerable in your household. I do want to remind folks that the recommendation is very serious for people who are older and people who have underlying health conditions. They should be staying at home, and we all should be doing our part to make it easy for them to have everything they need to stay at home. They should not be going to the grocery store. They should not be needing to go to the pharmacies to pick up their medications. We can all help with that. The county will help with that by making sure that we're checking in on people we know who are older or home with underlying health conditions and taking that burden off of them so that you can drop off groceries on someone's doorstep. You can arrange to go and pick up needed medications. We're all going to need to help each other in order to be able to actually adhere to the social distancing requirements that at this point are absolutely essential if we're not to see a rapid rise in many, many more cases than we need to see. We can actually reduce the number. We can't go to zero at this point in time, but we can definitely slow the spread. But it takes every single person to do everything they can to take precautions all day, every day, with everybody they're in contact with. And I want to close by saying, if you're feeling stressed and overwhelmed, and I know so many of us are, I'd like you to know that there is a phone line where you can call. It's 24/7 services by our Department of Mental Health, their Access Center. It's 800-854-7771. That's 800-854-7771. And as always, we will deploy really good information on our website. It changes all the time. We provide updates, so that's publichealth.lacounty.gov. And now I'm going to turn it over to Dr. Galley, who's going to talk more about how our healthcare system is getting prepared.
Good afternoon. I'm Dr. Christina Galley, the Director of the Department of Health Services. First, I want to extend my thanks to all those healthcare workers and first responders on the front line. I know you are all working very hard, and we are so grateful for your continued service. I also want to extend my condolences to the family of the individual who passed away. We all do indeed mourn with you. We know that this is an incredibly difficult time, and we share in your sorrow and are very sorry for the loss. Our healthcare system is only as strong as those who provide the care on the front lines every day, and we need to protect both the system and the people who work within it. The best way to do that is to practice the social distancing guidance that has been put out by the Department of Public Health and that Dr. Farrar has described. Social distancing, staying at home when you can, limiting your contact with groups, limiting events, closing stores as needed is the best way to help keep separation between people and make sure we're not accelerating the spread of the virus between one another and in the broader community. It's absolutely essential in order to help protect people that have underlying health conditions, people who are pregnant, and people who are elderly who are at particular risk of adverse complications from the virus. We, at this point, as we know, we can't contain the virus. We can only stop its spread and help mitigate its spread over time and mitigate the consequences on individuals' health and life. So please follow all the guidance that you hear here and in other settings, the guidance that's on the public health website, and practice social distancing to the greatest extent possible. It's also critical that we continue to preserve 911 and emergency services. So please, as I've mentioned before, don't go to the hospital just for testing. Hospitals and 911 system and the emergency departments need to remain available for those with medical emergencies. Please, if you feel like you might be a candidate for testing, call your provider so that they can discuss with you the specific conditions, your underlying health history, and whatever situation you might be in your symptoms, and they will provide you with guidance. If you need help finding a provider, you can call the county's 211 system and they will assist you. Also, we still, as I've mentioned before, urgently need blood products. So I would encourage all those people who are healthy and are able to give blood to consider doing so. We still have a critical shortage of blood products across Southern California as well as the rest of the nation, and we need people to come forward and be willing to donate blood. It is safe to do so, and that blood could save a life for someone who needs it. So please contact the local American Red Cross. You can visit their website, you can use their app, and they have listings of available donation options near you. In terms of the latest bed capacity, the data that I'll report as per usual is based on self-reports from the hospitals across the county and the 911 receiving centers located in a geographic breadth across the county. The data is self-reported on a daily basis to the Emergency Medical Services Agency. There's about 22,000 beds in the county. Of those, about 2,200 are ICU beds. As of this morning, there were about 870 open non-ICU or non-intensive care unit beds and another 185 open beds that were of ICU level of care or intensive care unit level of care. Within the Department of Health Services for acute care hospitals, we run about 1,500 beds. We are operating still at about 69 to 70% capacity, meaning that we have currently about 460 beds available. Of those, about 184 beds are ICU, and of those still, about 52 are open for an overall occupancy rate in the ICUs of about 65%. Within the DHS system, our hospitals are still preparing to be able to flex different units within the hospitals to be able to meet anticipated increases in demand in the near future. Other private hospitals are doing the same. This is called bringing hospitals up to their surge capacity or implementing their surge plans. For those who aren't familiar with this term, surge planning is what hospitals routinely do when they anticipate or are actually facing higher volumes of patients than what they would be normally able to provide services for under normal working conditions. There's a variety of ways in which hospitals do this, and the hospitals across the county, as well as within DHS, are taking those actions as are deemed necessary. State and federal government are also working to bring on other levels of care online so that we can accommodate the demand in the near future. This includes a mix of different levels. This might include acute care, lower levels of care, as well as opportunities for isolation and quarantine for those who need it and don't have an alternative place to go. The EMS agency also continues to work with our state and our federal partners to make sure that they are processing the increase in stockpile equipment that is being delivered, and they are distributing that out to providers and first responders on an as-needed basis. In closing, let me just say what I know we all know and feel is that these are unprecedented times. We need to follow the guidance of our public health experts. That is the best way to flatten the curve of this pandemic and make sure that the volume of cases comes in a way that doesn't overwhelm the hospitals and the health systems who ultimately will care for the individuals who have serious symptoms as a result of COVID-19. So thank you so much for following that guidance and for practicing social distancing.